So most patients with liver cancer have a disease called hepatocellular carcinoma. It's tumors that arise within the liver, typically in the setting of cirrhosis, but not always. Our goal is to remove the tumor completely. As you mentioned, there are several different options. There's ablative therapies, chemoembolization, systemic chemotherapy, and surgery. Our goal with surgery is to remove the tumor completely with a clean margin that makes sure that the risk of recurrence of the tumor is as low as possible.
Well, and this is sort of a layman's question, but how much of the liver can you remove safely?
So we can remove up to 75% safely in most patients who don't have cirrhosis. In patients with cirrhosis, it's typically a smaller percentage, and it depends on how much we need to remove. Patients with cirrhosis, we typically remove as little as possible.
What are some of the main challenges of liver surgery?
Well, operating on the liver is an extremely well vascularized structure with artery and vein flow into the liver. So one of the major issues is making sure that the operation is done safely, obtaining a clean margin, but at the same time minimizing blood loss. In centers like ours, which are extremely experienced in liver surgery, we have an entire team, both anesthesiologists as well as surgeons and hepatologists who are familiar with how to prepare patients and manage patients during the operation and afterwards to minimize the amount of blood that is lost during the operation and the consequences or sequelae of removing a piece of liver and the damage that might occur to the liver.